histolytica, the parasite that causes amoebiasis, and is one of the many causes of bloody diarrhea. Histolytica probably makes you think of history or historical. And in this case, our scene will take place at a historical excavation site. So let's just get right to it. We're drawing this sign down here at the bottom right that says "Do not enter historical site." We bolded "ent" and "hist," of course, for Entamoeba histolytica. So, just curious, what do you think about the shape of the dig site? I hope you're thinking, gee, that looks like a liver, because if so, you're a Sketchy Microbe pro. And I'll get to why it looks like that in a little bit, but first let's talk about transmission and the life cycle. So like other parasites, Entamoeba histolytica has two main life cycle stages that you need to be aware of. First, we'll draw these bubbles in a puddle here. And if you've seen the Giardia video, you'd recall that this is a recurring symbol for what? Right, cysts. The cyst form is infectious when it's ingested, which is usually from contaminated water. And this is shown here with these archaeologists drinking dirty water with the cyst bubbles in it. And also there's an important association between this infection and men who have sex with men, which is why these two men are holding hands. And this is due to anal-oral transmission. During the second part of the life cycle, while the cyst form resides in the GI tract, it differentiates into trophozoites, which invade the colon and can spread via the portal circulation to the liver. So this is where our liver-shaped dig site comes into play. You'll notice that on the left side of the sketch, we have some archaeologists digging for a tomb in a very particular spot, in what would be the right lobe of the liver. We did this because this is the most common site that's involved for amoebic liver abscesses. This is also shown with a guy holding the map, which sort of looks like a CT scan of the liver. Although 70 to 80% of the lesions are solitary, there can also be multiple lesions. So, not surprisingly, patients with amoebic liver abscesses complain of right upper quadrant pain and may have enlarged and tender livers. And this is demonstrated with this man here clutching his right upper quadrant. And the pus that's inside one of these abscesses is classically described as having the consistency and probably the smell of anchovy paste. So to represent this, we'll make this truck in the background have anchovy paste written across the side of it. And also, we'll make some of our archaeologists here eating sandwiches with anchovy paste dripping out of it. So aside from liver abscesses, Entamoeba histolytica also causes intestinal amoebiasis. So we'll draw in this drainage pipe here with outpouchings that look like haustra to represent the colon. Entamoeba can cause ulcerations along the colon, which are illustrated by these rust spots. More specifically, if you were to look under the microscope, you'd see flask-shaped ulcers, kind of shaped like these Erlenmeyer flasks here that these archaeologists have in their hands. As you can imagine, ulcers in the colon means that Entamoeba is invasive, and as such, it'll cause bloody diarrhea, or dysentery, which is depicted by these archaeologists sitting on the red stools, as well as the massive amounts of diarrhea water pouring out of this large colon drain pipe here. There are a few ways we can diagnose an infection with Entamoeba. One way, of course, is to just go straight where the money is and get a stool OMP to look for cysts or trophozoites, as illustrated here with an OMP on the side of the pipe. An important buzzword or image for identifying Entamoeba under the microscope is the presence of trophozoites that contain endocytosed red blood cells. So here's this picture, and you can see it's packed full of these endocytosed RBCs surrounding this nucleus here. You should definitely commit this image to memory, and to help you with that, we'll draw in a puddle here that looks like a trophozoite, and these floating red cups here look like endocytosed red blood cells. It's kind of like Entamoeba gets hungry and impatient on the way to the liver, so it grabs a few red blood cells as a snack while it's making its way up the portal circulation. The last way to diagnose Entamoeba is that you can perform an ELISA antigen test on stool and serum, or perform serology to detect Entamoeba antibodies. Also, if a patient with intestinal amoebiasis gets a colonoscopy or sigmoidoscopy, you would collect those biopsy specimens in which you would see the flask-shaped lesions. And again, that's why we have this flask here in the colon. So now that we've made the diagnosis, it's time to treat it. The drug of choice is, actually, I'll let you guess what it is, keeping in mind that we're in an underground scene. Here it is. It's a metro, for metronidazole. I've said a lot of times by now, but I'm always so blown away at how perfectly metronidazole fits in our sketches. You would think it'd be such a tough recurring symbol to work in, but somehow it always fits really nicely. Alright, so we have metronidazole. However, there are a couple other drugs that we can use that work by eliminating cysts while they're in the lumen of the intestine, an area where drugs often have a hard time penetrating. So these next two drugs are referred to as luminal agents. The first drug, and the more commonly tested, is paramycin. And to help you remember this, we'll draw in a pair of mice next to the metro. And in fact, they're running out of the lumen of the metro tunnel. So these pair of mice in the lumen should remind you that paramycin is a luminal agent. And what can I say, this also fits pretty perfectly for our subterranean scene. The other luminal agent is called iodoquinol. So to illustrate this, we're going to add this sign here where the archaeologists are digging that's labeled Queen Iodo's tomb. You can see Queen Iodo's head in the dig site as well. Queen Iodo is, of course, the famous Egyptian queen from back in the time when no one wrote anything down and there weren't any oral traditions or anything like that. So you'll just have to take our word for it when we say, yeah, she really existed. Anyway, iodoquinol, aka Queen Iodo, is another luminal agent that can be used in combination with metronidazole. Now, this concept of treating it medically is very important. In contrast to echinococcus, which can also cause a mass in the liver, you wouldn't operate with Entamoeba liver abscesses. Although sticking a scalpel in something full of anchovy paste sounds like it would be satisfying, very rarely would you ever need to surgically drain Entamoeba. Test makers love to give you a story of a patient with a liver mass and make you figure out if it's Entamoeba or echinococcus, which of course sound kind of similar. And then they ask you how you would treat it. But no need to worry. You've got this picture of the historical dig site to help you remember that the metro, the paramice, and Queen Iodo are the treatments. And that's it for Entamoeba. So other than the treatments, remember the key buzzwords, which are anchovy paste and those endocytosed red blood cells within the trophozoites. And that'll do it.